Now that we've reviewed the application of the long arm posterior splint, we're going to move on to the next type of splint that is easily applied in an office setting, and that is the sugar tongue splint. We use the sugar tongue splint primarily for fractures of the distal radius and or distal ulna. Again, the mechanism often is similar in that your patient it would have likely been on the monkey bars or some playground equipment, taken a fall on an outstretched hand, resulting in a fracture of the distal radius or distal ulnar, or very commonly both, which is referred to as a both bone forearm fracture, or BBFF. Now we're going to have James show us the application of the sugar tongue splint for distal radius ulnar fractures.
All right. The application of your web roll and stockinette, as previously mentioned, is the exact same way. Two pieces, one for the distal and one for the proximal. Web roll wrapped by half. And now you need to cut a piece of your orthoglass, which we have pre-cut. So in this instance, your measurement is different. You're going to bring the patient back up at a 90 degree at the elbow. Okay, like so. But you want to measure your orthoglass from the volar palmar crease, under the elbow, and back to the palmar, to the dorsal side of the hand. Like so. Come under the elbow, and come back up. And now I have to trim that a little bit. Now when applying this, be sure that this splint is pushed past the olecranon, okay? It should not be sitting in front of the olecranon like this. It should be past it, such as that. Okay, so let's cut this down, and we're going to apply this. Remember, make sure your edges are nice and smooth, and that there are no prickly edges to this orthoglass. Okay, and remember to do both sides.
And in real life, James usually takes this opportunity to talk to his patient and tell them about how they're going to care for the splint at home. When we are working, we are trying to be very efficient and handle everything and have very little downtime, so we're taking advantage of the opportunity here while we're doing things to also educate the patient and the families.
Remember, you will wet one side of this before the application, okay?
So to review, we talked earlier about the long arm posterior splint. If you're in your office and you see a patient and you're trying to decide what splint to choose from, whether it be the long arm posterior or the sugar tongue, remember that ultimately, as long as you splint the joint involved in the fracture, you're doing fine. How do we decide what to use? The long arm posterior splint we use primarily for injuries in the elbow region. The sugar tongue splint we choose to use primarily for injuries of the distal radius and distal ulnar at the wrist. How's that going, James?
Doing great. So I'm going to have you hold him there. In your office setting, you would realistically want to have a buddy hold your patient's arm because they will get tired. Okay. Now when you get here, it's okay to tuck your orthoglass to conform it to your patient's elbow.
Now, we also will take a moment to talk about where your patient will be going at this point once the splint is fully applied. Again, we've applied the sugar tongue splint, so we're going to talk about the distal radius ulnar fractures. We use different criteria for follow-up based upon the angulation or lack thereof of the actual fracture. Generally speaking, for fractures of the distal radius that are angulated greater than 10 degrees, your patient is probably going to leave your office and go see the orthopedist that day or the next day to have a closed reduction, potentially under sedation. For the fractures that are less than 10 degrees angulated or not angulated at all, such as a buccal fracture, those patients you may send home from your office and then direct them to seek orthopedic follow-up within the next 5 to 7 days. Again, this was application of the sugar tongue splint, generally used for distal radius ulnar fractures.